If you see a question in your NCLEX that says something about this baby being in a harness, I don't want you to panic. I want you to think hip. I'm gonna tell you exactly what you need to know about Pavlik harness. Properly care for these patients and what the NCLEX actually wants you to know. I'm gonna tell you exactly what you need to know. No more, no less, no fluff. Let's go. Why is a Pavlik harness used? Well, there's something called DDH, a developmental dysplasia of the hips. This happens in our pediatric patients. Developmental problem. Remember that. With DDH, they have unstable or dislocated hip joints. The femoral head doesn't sit perfectly in that socket in the hip. So the risk factors for this happens when there's a breech birth. It's more often in firstborn babies, or if there's a family history of this. The big thing I want you to know is if it's untreated, have a gait problem and they will have early arthritis. What the harness actually does to help this is it keeps the hips flexed and abducted. It helps that head stay in the socket so the hip can actually form properly. NCLEX clues I want you to pick up on when it comes to this is it's seen in newborn and infants. Something called a positive Barlow or Ortolani sign. They have asymmetrical thighs or the gluteal folds will be uneven. They have limited hip abduction. NCLEX answer tips. This is the biggest thing I want you to remember. Do not remove that harness unless it's prescribed specifically by the doctor. Check the skin daily for breakdown. A diaper goes under the straps. Know that. That has specifically been an answer on the NCLEX. Don't move the harness. Dress that baby in very loose clothing. Don't swaddle those legs straight together. Don't adjust those straps at home. Parent teaching priority, I want you to know. That harness is actually worn for 23 hours a day. Have proper positioning will prevent surgery later. The question says something about an infant plus hip instability plus harness. I want you to choose Pavlik harness for DDH, and teaching and skincare are your priorities. That is usually the correct answer. That's what you need to know about Pavlik harness. Hope this helps. If you want more information just like this, grab my course, Simply NCLEX. It's helping students pass their NCLEX every single day. I have everything that has mostly been on the NCLEX recently, plus all the high yield, how to break down questions, all of the topics that you need to know to pass. I keep it very simple. It's not content overload. It's so valuable. If you have any questions about that, message me or go to the top of my page, grab it right now so you can pass your NCLEX. And I hope this helps. Make sure you hit all of these buttons for me. Happy studying.